Welcome to Well and Back, the podcast hosted by three passionate osteopaths and wellness entrepreneurs, Justine Treadwell, Chloe Lawton, and Lauren Malott. We're opening up our inner circle of holistic health practitioners we think everyone should have access to. Listen in as we share our personal and professional perspectives on how our bodies respond to our everyday choices, as well as our favorite health tips and tools to help us feel good and move well. Holly is an osteopathic manual practitioner. She's an associate professor at the Canadian Academy of Osteopathy. She's also the owner of Still Dynamics. As a colleague, a mentor, and a former teacher, we're really excited to have Holly on here with us today. Holly, if you want to start off giving us a bit of a background on what led you to the place where you are now with 2 clinics under your belt.
I kept imagining a place where you can have a practice, but all the practitioners share time to be a walk-in clinic, where if somebody walks in, they're able to be seen. And first of all, it's fun as a practitioner. I know it sounds terrible when you get an acute person because it makes your mind go, you've got this acute spasm, you want to shut it down and find the problem, the cause. It's rewarding. You have someone come in who can't walk and then they walk out. Also for a patient, sometimes you don't get that treated right away and then you go see someone after all the compensations. It can take a lot more time to get it out, and they might go back through that pain as you're taking out the compensations. And I just started dreaming more and more about it being a one-stop heal shop that has access to everything that's kind of holistic and can help on the spot. And live blood analysis being one of those things where you're sick right now, let's see what's happening in your blood right now. And instead of waiting for tests, I think for me, that's just my goal was always going to a place and creating a place where osteopathy could thrive and practitioners could meet in the lunchroom and talk about, I have a patient, I'm struggling with this, and bouncing ideas off each other, treating each other, keeping each other on our toes, and giving feedback and just supporting each other. I think there's just this warmth of an environment where you come into a place like this, and if someone comes in and they can't see, let's say, Lauren, they know they've seen me in passing or they've seen one of our practitioners and they're comfortable when it's time maybe to go see them. So it's just a place where I wanted people to come in, get treated, and trust us with their bodies, because that's what they're doing, is trusting us with their health.
I think that's really what we want to talk about today, is to see manual therapy and osteopathy specifically as a means of healthcare. Full body healthcare, not just your aches and pains and acute cases that are great that they have you to walk in your door, but it's so much more than that.
Absolutely. I agree.
So going from your first location that was strictly osteopathy to then adding in different modalities in your second clinic, how did you pick which modalities aligned and which didn't align?
It's really just trying to fill in the holes of osteopathy in terms of someone's ability to get proper nutrition or supplement if they have certain things that they're not able to absorb or take into their body, or tests that we aren't able to run as osteopaths, and to see what else is going on. So I think that's how I chose a naturopath and live blood analysis, and more recently neurooptimal, which I find so intriguing. And then just little things that help afterwards, like a salt cave that helps with inhalation therapy that gives you a whole bunch of minerals and things that, we just aren't able to get all the time, especially we're not by the ocean.
So it started with live blood analysis and naturopathic services, and then kind of stemmed from there. But I think it's really improving nutritive blood flow to the area, but then that's dependent on the quality of that person's blood. And it's going to have a bidirectional relationship. When your body is functioning better, that's going to impact the quality of your blood. But when the quality of your blood is better, your body's going to be functioning better as well. So from an osteopathic standpoint, we look to free up any obstructions and improve circulation. So nerve conduction, blood flow, arterial and venous. So good blood to the area and drawing out waste and byproducts from that tissue. Yes, osteopathy is complete on its own, but it's also making sure that the person's constitution is where we need it to be in order for osteopathy to be as effective as it's capable of being.
Absolutely.
Yeah.
Well put.
And I think it's to that point of just building a team around you, it's something that we are trying to do even with this podcast, is just highlight different modalities that you should explore and could really impact and benefit your health, so that when something may go wrong, you feel confident in the team that you have set up around you. And that's something that I feel passionate about with osteopathy, is to really change that narrative from that musculoskeletal specific treatment that feels like it doesn't go anything beyond that, when we as practitioners know it is affecting so much more, like Lauren was saying, like nerve conduction, circulation. My ideal scenario would be a yearly checkup that you would see your family doctor so that your internal markers are getting checked. But there is a gap that happens in between if we're not looking at the structure of the body and we're just looking at the result. So if we can really highlight or explain to people that we are treating health conditions, and maybe we're not diagnosing or we can't prescribe anything, but I think it's really interesting to hear different cases that may come into the clinic that have had great results from hands-on work. So if there's any examples that come to mind with that are maybe cases that are a bit idiopathic, something like fibromyalgia without an answer, or something like hypothyroidism, which I feel is so common, consistent migraines, asthma, eczema, like just the range of conditions that people are finding results in with hands-on work that majority of people would never think would be osteopathic.
I have to say, I do have so many times where people come in and they'll be like, you know what? I don't know if this is because of anything you're doing, but something about their physiology or how their body's functioning has changed and is better. And you're just sitting there, you want us to scream, yeah, that's because you're helping the structure function properly, right? You're creating a house that has the proper conduction and blood flow, and something so simple that it's almost frustrating, because there's so many other approaches that happen to something that could be so just an easy little structural fix that actually stops that loop or that negative impact. And I think, and I say this to all my patients, actually, I talk about the greatest gift of osteopathy is body awareness. And the more we clear up all the structural strains and aches and pains, or things that they don't even know they have, which you often get like, oh, I didn't even know that was bothering me. That's a general numbing to your system, where you have just this overall ache or nothing at all because it's just compensated so much. Then there's just this general, oh, this is just the way it is. I have to stretch every day. And they don't realize that it's a combination of a whole bunch of things that have happened. And or the straw that breaks the camel's back, when all these compensations happen, and then all of a sudden out of nowhere, just reaching over puts your back out. And you're like, what? That came out of nowhere. But really, your body's been put under all these different stresses and compensations that it just couldn't do anymore. And so when you get to come to osteopathy and you start clearing up all that stuff, and you start there, I thought I had to live with that. I thought that was going to be there forever, or like my periods were always painful. Like now that I don't even know when they're coming, and so I have to pay attention to my schedule, and just things like that. That it is, like I said, the greatest gift is that you're getting this body awareness that you've been numb to because you weren't listening to it for so long. And so then that when something small happens, it's so nagging and so irritating, and you I need to get rid of this, because you don't have everything kind of dulling that sensation, if that makes sense. So, we talk about the different laws that of sensitivity and such, but we don't really even need to get into that. You can just talk about your brain's getting so much information that it kind of dulls the sensations. And so you take away all those layers, and now we can deal with the actual issue. And so they can take onus on their own treatment and take on what you're doing. And there's a gentle way of being able to speak very layman's so that they can start to take hold of their own health. But talking to cases that you're speaking of, that where something like osteopathy stepped in, I did have actually in my third year a lady who was diagnosed with MS. She had no function of her left arm, and she was actually going into a wheelchair when I met her. And when I was treating her, a lot of what I was finding was around digestion, around liver, around like gallbladder, and I just treated them. And as I treated them, she started gaining like these functions that she was told she'd never get back. And I was like, oh, sometimes like, clearing things up, your body's going to be able to work on some things, or, just trying to like, in my head going like, this is amazing. Like, but I'm not saying it's me that's doing it or osteopathy. I'm just, we're treating the body's functioning better. And flash forward 6 months, she was completely out of her wheelchair and she had regained function of her left arm. And a year had passed and she actually was working out at a gym. Wow. And so looking at that from an osteopathic perspective, you walk back and you're like, what could that have been? Her doctors told her that she was falsely diagnosed. And so they went about it in a different way. But for me, I sat there going, I found all this digestion stuff. I found all this liver, gallbladder. Like I'm thinking like fat assimilation. Like she was having trouble assimilating fat, which is required for the myelin sheath around nerves and conductivity and health of a nerve. And so naturally, we know the body, whenever it's in trouble, will always protect the vital organs first, heart and lung, and start to kill off the periphery, right? And so that's mimicking MS. That's what MS is, right? So looking at, not saying that MS isn't a thing and it's always going to be a digestive issue. That's not at all what I'm saying. I'm just saying in that situation, I feel like maybe her digestion was part of the problem. And so by clearing that stuff up, here she was going down this rabbit hole and going into a wheelchair and thought she had to live with this. And I mean, she's living a different life.
Yeah, wow. I know it was a while back, like you said, but can you describe maybe certain findings that could have led you to thinking liver, gallbladder, like certain structural findings that brought you to visceral?
So when we talk about, like, obviously there was a lot of lesioning and thickened tissue around her dorsal spine. We're looking at D5 to 9, but also we were looking at reflexive kind of lesioning where tonicity of skin had changed, rubbery feelings, things like that. Chicken or the egg, is it viscero-somatic, somatic viscero? For those who don't know what that is, like, is it the structure going after the organs, or is the organ affecting the structure? There's a natural dulling from structure to affect organs, because you don't want every time you pull your back out to have this physiologic expression, right? But so there has to be a lot of different firings for it to eventually have that effect. So that's like a more long-standing. Whereas opposite, you're going to see a viscerosomatic quicker because your body's trying to tell you that there's something going on viscerally. So I mean, when you see a viscerosomatic, you're going to start to see it in the soma, you're going to see it in the skin, you're going to like that rubbery, plastic looking feeling. But again, chicken or the egg, doesn't matter, treat it and let's see what happens. So we just started breaking it up, and obviously with care, with a thought process and never doing too much, so she could take on the treatment. So I did take about a good 6 months of like every week.
So many people don't realize that viscero-somato or somato-visceral response, you can have something going on in one system or one organ field, but it can have a response elsewhere. So there can be like referral
like there's spillover, right?
Yeah.
So our sympathetic chain, unfortunately, like it can travel within that sympathetic chain. So it can travel up, it can travel down. There's there's specific segments, but there's also expression. And that's one of the main reasons why I think osteopathy has a hard time being able to even say that they can do those things, because it takes research and it takes a lot of clinic-based responses, but everyone's expressions are always different. How they take treatment on is different, so their responses and structure and function are interrelated in health, but in healing it's delayed. So you can fix a structure, but you're gonna the healing process of the tissues involved, or the visceral involved, or the nerves involved, that takes time. And we know, just from injury, when you roll your ankle, it's not, you start being able to walk on it, but the tissue still hurts. How do you say these 20 people got treatment and these 20 people had this response, when there's too many variables that change a person and how they have responses? So it's one of the hardest things that osteopathy's ever come across is having research-based results.
I think that that's something that we come across in practice all the time is a patient coming in and do you treat bursitis or what do I need to do for tendinitis? And it's like, we don't look at it the same way as other modalities or allopathic healthcare does, because to say we treat that is just to name the symptom. And so it's looking at it differently and understanding. What I try to articulate with patients is it's not just about treating bursitis or treating the one bursa, because it's like, why is that happening in that knee and not the other, and why not anywhere else, and why today? Doing a pattern that you've been doing for 15 years and it's only showing up now. It's like, okay, let's work through the pattern, but at the end of the day, we're less concerned with that one specific area and more looking at restrictions throughout the body and impaired mechanics as a whole.
Absolutely. And looking at also the mental, or can be quite detrimental, because they are looming over them, or it gives them despair. Or you hear people who were living through having cancer, didn't know, got told they had it, and then they were gone in a weekend. Like my husband's grandfather, he was going for walks, doing all this stuff. He got told he had cancer, and he was in bed, couldn't move. Next thing you know, he was gone on the Monday. And it was how much mental, how much brain was involved in that, right? Like giving up or not wanting to get better, or starting to really love their lesion. And I know that sounds terrible, but there are people out there who love the attention that they get from being ill. And so, like not wanting to heal is a huge part of osteopathy. And I think even when I treat people and I see something, I'm like, oh, there's some stuff going on. I'll always be like, oh no, it's nothing I haven't seen before. And not giving them a chance to have a negative outlook on it or linger on it. I think that helps with the patient learning to take on treatment too, like without them knowing it. I always bring it to like a lighter note, because I'm also healing the way that they think.
Yeah. I think that that's such a good point. Healing the way that they think, or changing the relationship they have with their body and with what's happening, and feeling like, okay, it's not something that has happened to you. It's just an effect based on the cause. And we'll figure out what that is, or we'll eliminate that input that's causing the output that you're seeing today.
Exactly. Yeah. I think that a lot of times we've just been used to learning that the medical system is supposed to provide us with answers. So we're just looking for an answer to what is wrong with us. And I think you go through the steps to rule out all these scary things that it could be. But if you just get into your body and try and check off everything that's not functioning properly from a physical standpoint, from an objective standpoint, you can probably clear out a lot of the stuff that may be scary on paper before it even gets to that point. It just comes back to the idea of prevention and trying to start as soon as you can, so that your foundation can handle anything that is potentially going to arise in the future. And I guess that brings us into, obviously, anybody hearing today, it would be like, it could be a range of ages, and maybe you've never had an osteopathic appointment and you'd like to see what symptoms you can resolve within yourself. But looking at an ideal situation as integrating osteopathy from a point of birth onward, or somebody looking as a future mom and how even their state during pregnancy can affect then their delivery or the development of their child, and just starting at the earliest point you can to set yourself up and your child up for a life of ease, rather than all of these factors that can compile and potentially start disease in the body.
Absolutely. You look at the egg that gets implanted is starting its growing period a year from the day that it gets dropped. So you starting to eat healthier, looking at maintaining an overall health to your body at all times. And I've treated people who, are told that they probably wouldn't be able to have children. And you see like they've got this retroverted uterus, or they've got a pelvic tilt that's quite serious, and blood flow to the area and nerve flow. You just start treating it. I'm not like, I'm going to help you get pregnant. I'm I'm going to make the house that your uterus is living in as optimal as possible, so that if there is an ability for it to heal or start functioning properly, you can then have a better chance of getting pregnant. And they have, and then you treat them through their pregnancy, and then you treat them after, and you treat their baby once they're born. It's kind of neat that you have this like little circle of life within your office. But bringing it back again to what can osteopathy do?
It just makes sense that if you feel like if something is off in your body or you're not functioning optimally, that you are eliminating the fact that nothing is structurally off. And I think that it has gone so far past that it sounds so simple that it's almost hard to believe that it's such a lost concept in so many elements of healthcare.
Doing it at a younger age is huge, because you're able to know when something's not quite right, and you're more in tune with when something is not feeling right. And that gives you such a great opportunity, because if you can get it treated right away and don't allow for compensation, or if there is a small reflex, change that loop as fast as you can so it doesn't cause other issues. It's only going to amplify everything that you're doing in life, whether it be through sports or even just everyday function. Having the energy to get through your day, the ability to focus, have a clear mind, even have drive and motivation in your life. You don't have lymphatic flow, you get really tired, you get sluggish, you get like foggy brain, your eyes get tired or easy with like OA dysfunction, and you have trouble focusing, and you start reading a book and you want to sleep. So I find just staying on top of it early and seeking an osteopath that is quite knowledgeable, and it's such a saturated world and unfortunately not regulated. So finding one that is principle based and having that conversation with them. And I think there's also a huge thing to be said for if you jive with your practitioner or not. Mm-hmm. And I mean, be able to trust them, express things to them. If you feel comfortable in that room, feel comfortable being adjusted by them, are able to have like a good connection that way. It's very important, because there is an element of that in treatment where you're giving yourself to them and allowing them to manipulate you. If you're guarded, things like that, the nervous system's quite crazy. Yeah. If you're guarded, you're not going to take on a treatment very well either. One of our teachers, when we were going through school, was talking about how this person was not getting better, and that came out the third or fourth time, I can't remember, that he looked exactly like an ex. Yeah. that she did not like. Yeah. And so she was having a really hard time feeling comfortable in his room and being very humble in this environment, which we find at our clinic, Lauren. If you're having trouble with one person or something going on, being able to ask for help. And so he sent her to someone else, and they were able to get results with them right away, because there wasn't that same animosity in the room.
It also helps understand from a practitioner standpoint, you're trying all these different routes and different doors, and you just keep hitting this block. And sometimes it can be an interpersonal barrier. Like it can be that person doesn't feel safe or doesn't connect with you. Or sometimes it can be what you're doing is stimulating a neural loop from a negative past experience. And there's
or even as a practitioner, you've been treating that person for a while, so you're kind of blinded by it. Like, I am a very comfortable practitioner. I treat children all the time. I cannot treat my daughter. I literally can't. It's so strange. And I can't put words to it. I question everything when I'm treating her. And she had this block of extension in her chest when I had a really rough delivery and almost died, and my daughter came out limp, and she wasn't breathing properly, and they had to bring her back and then had an oxygen mask on her for a while, and there's reflexes of that in her upper thorax, and it was for a while just a chunk of red. And you know how we would get lesions and you'd be like, what could this cause in school? And you like go down these rabbit holes. You could like, so every time I see that, I just would like, I'd be like, she's going to die. Like, it's just all wherewithal is gone. And so they do say don't treat family. I used to think it was because my family annoys me and I feel like I don't treat them well because they annoy me. But I think there's a lot more to it.
Yeah. It's hard objectively treating what you find because that's tied in, but also you were a part of that experience. You also have your own trauma and experiences that happened during that time. So as you're unraveling that lesion or working through it, it's also stimulating stuff for you too. There's just so much involved.
I feel like that's also a huge point, is how traumatic sometimes the birth experience can be, that for mom and baby, that I think it's a huge window of opportunity to be able to take advantage of the beginning stages to treat an infant. And there is a bit of controversy of when you should intervene and what you should allow to be and when to take action. So even if it's not you hands-on with your daughter, do you have any thoughts on that and different developmental stages with a baby and when to intervene or when to let things be?
I mean, going through the birth canal is quite traumatic. How you're situated on the inside can be a little bit molding, but like, unless it's like constantly there and it's more of a birth defect. I always find doing a once over and making sure there's no positional things. The whole goal is that the body learns to heal itself. So although I'll bring them back, doesn't mean I'll necessarily treat them. Or there's times where it is needed. Like I had a patient, the poor mom, like this child, she said he had two modes. It was crying and screaming and never stopped crying. I was always uncomfortable. And when I treated him, there was quite a torsion through his diaphragm, and his stomach was so distended and was just gas. And when we were done, and he had let off a lot while we were treating, it was like you could palpate it again. It wasn't a bubble.
Right.
And he was just sitting there laughing and giggling, and the mom just like broke down crying. She hadn't seen her son like that at all. And so that was a huge thing for her. And, sometimes like, I'm like, how did you last this long, like to get him here? Because he was, I think already like 3 months at the time. Like, man, you're a saint. Like for him to be screaming like that all the time.
People often confused, like, okay, it could be temperament and the personality or the baby, but it could also be at that stage they don't have any other ways of expressing. That temperament is an expression of what they're uncomfortable. The reason that their baby's having a hard time latching might have been because of a difficult delivery and an extension in the cervicals.
And something like ear infections, to be able to intervene for a structural cause of that, to prevent overuse of antibiotics early on.
Just understanding the growth of the eustachian tube, right? How it's more vertical when they're born and then it has to drop, so that not being able to drain properly.
And I think that's a big thing about it too, is I know we mentioned being humble practitioners and removing ego from it, because I see in so many things online or just speaking with different practitioners, everybody wants to have the one answer or the one solution. And I feel half the time my answers to patients are actually like, it could be X, Y, Z, and other things I didn't even mention. And they think that you have no idea what you're talking about. But it's actually like, if I gave you one answer, then I would have no idea what I was talking about. And I just think, to remove the ego side of things and just look for results. And don't get fixated on the diagnosis. Let's see if it gets better, and then focus on that and ride that.
Yeah, absolutely. Dr. Still said an osteopath searches for health. Anyone can find disease.
Thanks for tuning in to Well and Back. We hope you enjoyed this episode and gained some valuable insights into living your best life. Make sure to check out the show notes in the description for a rundown on today's episode. We are truly passionate about providing you with the best information and resources to help you on your wellness journey. For even more content, follow us on Instagram and TikTok at Well and Back. please consider taking a moment to rate, review, and subscribe to our podcast. By letting us know how this episode resonated with you or what you'd like to hear more of, it helps us to continuously improve. Until you're back, we wish you well.